Hi friends, I am Dr. Abdequaem Chimthanawala. Today I have come up with one of the very rare drugs, but with very important indications I found in that patient. This patient, when he came to me, there are patients which always you remember because of some vague complaints they come with, and this is one of the patient. This patient came with only one symptom. The lady came only with one symptom, that was nausea and vomiting. She had nausea continuous, and she had nausea with most part of her daily routines. In her wordings, she told me, Doctor, I have nausea before menses, I have nausea after menses, I have nausea with smell of the food, with the sight of the food, I have nausea every time in the day. I said, anything else? So she said that I have taken a lot of reports, all reports are normal, but my nausea does not go. So my dear friends, whenever the word nausea, the patient tells us, the first drug that comes to our mind is of course Ipecac. And she had come from my friend's reference, so she had taken a lot of other medicines, so I thought that she might have already been given Ipecac. Whenever the word nausea comes to your mind, and constant nausea, there was a constant nausea. I'll describe the nausea and vomiting she told, but you must remember, whenever the patient is complaining about constant nausea, if you've seen the repertory, there are only 2-3 marking drugs. The first is Nux vomica and the second is Cilicia, where it is written stomach nausea continuous. And there are a lot of other 2 marking drugs that you should remember, that is digitalis, or you can remember Antim crude, Ipecac, creosote, Laccan, Lycopodium, all 2 marking drugs. So whenever nausea comes to your mind, these drugs you should remember. But as the patient started telling me symptoms, see how does the symptoms unfold and how does the remedy symptom changes to the remedy changes when you are well versed with your materia medica. So this patient came and told me that the lady would Doctor, I have nausea even when I think of the food. Whenever I am thinking of the food also, कि भाई आज घर पे पनीर की सब्जी बनी होंगी, अभी मैं सोचूं, if I think that paneer is cooked in my house, now also I am feeling nauseating. Or if I am going passing by the road and the hotel is there, the smell of the food of the hotel also causes nausea. Even I have nausea before menses. I have nausea after menses also. So this was and then she was going on and on with nausea, but those are the symptoms she have told you. And then she had vomiting. And she said that I had incessant vomiting. When I start vomiting, it comes out like incessant. It continuously it keeps vomiting. So I asked her that how the vomiting is better. What do you do if there is vomiting? So she said, sir, doctor has given me medicines for vomiting. I take that medicine and I feel better. Now this is no modality. So again you have to ask, if there is no medicine available or the medicine is over, what do you do? And she was so prompt in the answering the question. Okay, Doctor, whenever there is nausea, whenever there is vomiting and there is no medicines, I just lie on my back. मैं सीरियस हो जाती हूँ, चित्तस हो जाती हूँ. I lie on my back and the vomiting goes. And I do this because I have to avoid other medicines, no, because medicines are not good for health. So this was the modality of vomiting, and that is a very important symptom. Vomiting better by lying on back. Now see the case of nausea, vomiting, the whole 3 marking and 2 marking drugs, if you see, you will not get the symptom in that drug, and then you have to start thinking which is the remedy. Because apart from this, if you prescribe these drugs, she will feel partially better, a partial minimum, but no cure. So for a cure, you must be able to identify and define the symptoms so that you can go to the Simlimum. In fact, even she told me that I have aversion to the smell of food also. So much nausea, vomiting that developed aversion to food, the smell of food also. So a typical case where 3 marking symptoms are nausea and vomiting, but the defined symptoms are very important. The vomiting which is incessant is better lying on back. So now neither it is ipecac, nor it is Cilicia, nor it is Naxomica, nor it is D-talis, nor Antium crude, nor Lycopodium. Then which is the drug? A very important symptom. If you repetize this symptom, which will be the medicine given? Can you guess? When you repetize these symptoms, a very important drug that comes to the repertory chart is Symphoricarpus racemosus. Symphoricarpus, a very important remedy used for vomiting in pregnancy. But my dear friends, that is periodized mind. You never think of this drug apart from pregnancy, and then you fail to prescribe this remedy in normal patients. This lady was not pregnant, still she had symptoms. So if I have periodized mind, Symphoricarpus is a good medicine for vomiting in pregnancy, then I will never think of this drug. But in this case, if you repetize Symphoricarpus, nausea thinking about the food, nausea from smell of the food, nausea before menses, nausea during menses, vomiting incessant, vomiting better by lying on back, and smell of food aversion to, the whole set of symptoms, if you repetize, only one drug that will come is Symphoricarpus racemosus. I just prescribed that lady Symphoricarpus 1 ml, 1 dose, and told her to come after 15 days. And after 15 days, when she sat on the chair, the first thing she told, "Sir, I have eaten paneer and come, and no nausea even by eating and thinking of the paneer." This is the wordings of the patient, and this is the magic of homeopathy. So my dear friends, don't be periodized in prescribing medicines. Of course, it is a very important drug for vomiting during pregnancy, but apart from that, it has these symptoms also, which I was able to cure in a patient. So today we have learned a very important remedy, Symphoricarpus. If you like the video, please do share and subscribe. Thank you.